Many Americans think of their healthcare system as the worst in the developed world. Treatments can suck the last penny out of your pocket, leaving people with medical debt they'll pay off for the rest of their lives. In America, calling an ambulance has become a financial decision and not a medical one. That's why politicians like Bernie Sanders or AOC push for a radical transition into a universal healthcare system. And on paper it sounds attractive. No more debt, equal treatment for everyone, and an end to corporate greed. But as a German who has lived under universal healthcare my entire life, I can tell you the math does not add up. That's why I want to tell you about 3 structural flaws of universal healthcare that Americans tend to overlook. Now first, let's talk about individual responsibility. Because under universal healthcare, medical expenses are pooled. Whether through high income taxes or mandatory premiums, the general public has to carry the financial burden. But there's a systemic flaw to that, because it completely destroys the financial incentive to actually live a healthy life. Now just think about it for a moment. You could spend decades eating clean, working out, and taking care of your body, barely ever seeing the doctor. Yet you are forced to contribute just as much, if not even more, than someone who consistently makes terrible health decisions. You are directly subsidizing the medical consequences of chronic obesity, heavy smoking, and alcohol abuse. Now let's be perfectly clear. Providing a safety net for people who get sick due to bad luck, genetics, or accidents is a fair objection. But we are not talking about these cases. We are talking about preventable lifestyle-driven illnesses where people actively contribute to their own misery. When the general public is forced to pay for an individual's refusal to take responsibility, it stops being healthcare. It becomes an issue of fundamental justice. Because when you never see the actual price tag of your daily decisions, you simply stop caring about the cost. Secondly, let's talk about the tragedy of the commons. Now here's a basic rule of economics. When people get access to a service for free, they will eventually overuse it as if it has no value. Speaking of universal healthcare, it sounds amazing at first, but in the long run it completely destroys the quality of care. Let me give you an example. It's great that everyone has access to an emergency room. But if there's no price tag, people start using the emergency room for minor issues that a regular doctor could easily treat. Now ask yourself, if you ever have a life-threatening emergency, do you really want to sit for hours in a crowded hallway competing for a doctor's time with someone who showed up just because of a mild cold? Now that ain't a joke. It happens every day in the British NHS and in German hospitals. Medical resources are scarce, and in order to keep a system functional, you need to allocate those resources to the people who actually need them. When healthcare is free, the barrier to see a doctor disappears and the system gets flooded. Now let me give you an example of my country, Germany. In Germany, the average doctor now has an average time of 7.6 minutes per patient. And if you need to see a specialist, well, good luck, because you'll often have to wait months to get an appointment. Now third and finally, let's talk about the collapse of medical workforce, because that's a tragic byproduct of overusing the system. When a government eliminates the price tag and the general public floods the waiting rooms as we just discussed, it is the doctors and the nurses who have to absorb that endless tidal wave of patients. And to make matters worse, when the government takes over healthcare, they have to make sure that costs do not go out of control. That's why the state dictates exactly how much money a hospital gets for each treatment. There is no market, no competition, and no room for negotiation. Now here's the thing. Since hospitals are trapped in this strict bureaucratic straitjacket, they can't just raise the wages to reward the staff for the crushing workload. Instead, medical professionals face a brutal cocktail of hopeless understuffing, endless overtime, and a complete lack of financial appreciation. Now that triggers a massive dangerous brain drain. And in Germany, thousands of highly qualified doctors leave the country every single year. After the state spends hundreds of thousands of euros training them, they pack their bags and emigrate to countries like Switzerland or the United States, where skills are actually rewarded and they aren't crushed by the broken straight monopoly. Now what does that mean? Well, when you combine an infinite demand for healthcare with a burned out underpaid staff, the system doesn't just lower its quality, it will structurally break. Healthcare will always be a story of scarce resources. And on paper, a state monopoly might sound like the most compassionate answer. But in reality, well, we see the math simply doesn't add up. Now let's be clear, every country's healthcare system has its unique flaws, and so does especially the American one. And the grass is always greener somewhere else, except in this case, it isn't. Now what do you think? Should America take the risk of a universal healthcare system? Let me know in the comments below, and leave a like if this video gave you a new perspective, and I'll see you in the next one.